Pretty obvious what we're going to spend the majority of the time talking about today. Big news coming out of Houston, Texas last night in regards to American football, the greatest sport in the history of sports. J.J. Watt, is being reported that J.J. Watt re-injured his back. And Ross Villarreal just told us right before my voice came on air that it's official now, and correct me if I'm wrong. Thank you. He gives me the thumbs up. J.J. Watt has been placed on IR, injured reserve.
Yeah, if you think about a non-quarterback getting injured that could totally derail a team season, number one on that list to me would have to be J.J. Watt. All he did for defense, the things he did even on offense in red zone. This is a huge blow for the Texans, but I got to tell you, I think the Texans got to take a lot of responsibility for this. J.J. Watt injured his back, had surgery on July 21st, came back and played in the first game, which, I'm just telling you from my own experience, and I didn't have back surgery, but I had to have all those epidural steroid shots. Your back is a tricky thing, and I think he rushed himself back. I think the team had a duty to protect himself from himself and his doctors. And we're going to have a doctor join us, Dr. John Michels. And, in fact, he's joining us right now on the 790 IBE hotline. John Michels is a former first-round draft choice out of USC, played for the Packers, and is a Super Bowl champion. After bad knees ended his NFL career, he went to medical school. He now works at the Interventional Spine and Pain Institute in Dallas. He is double board certified in diagnostic radiology and pain medicine. John, I've been trying to get you in the trenches for a long time. I'm glad you're finally here.
Hey, thanks for having me on this morning, guys.
And first of all, just an overall great guy. I had a chance to meet him a couple of times. He's one of those guys, after you meet him, you kind of go look in the mirror and you start asking yourself, what are you doing with your life?
I think you're doing all right, Andy. You're doing all right.
Now we're both failures in life.
Yeah.
I feel horrible. Hey, John, J.J. Watt, our all-everything defensive end down here, had back surgery, and they called it a herniated disc. They said he had surgery for a herniated disc on July 21st. He started in the first game, and I'm guessing right now, but I think it was September 5th was the first game, somewhere around there. I thought because I had back problems caused my retirement that was too quick for him to come back. You've been on both sides of the equation. Was that too quick to come back for the surgery if he had actual herniated disc surgery? And does the team have a duty to protect the player from himself?
It's tough to say whether it was too quick for him to come back from that injury. Obviously, he's got trainers and medical doctors who are evaluating him consistently throughout the offseason and through his rehabilitation and assessing whether or not he's ready to play the game at the highest level. And both JJ and those medical professionals felt like he was ready to go. His situation was complicated because if you remember last year, he played through those core muscle tears.
Right.
He had 5 abdominal core muscle tears, and I think that's what precipitated the back injury.
Well, that's exactly what supports your back, right? Those core muscles?
They are, and whenever I see a patient who has a herniated disc in their back and we're treating them, after we're done with that treatment, a big component of their physical therapy is you have to work on your core strength and get your core strong in order to protect your back from further injury. And so the question is, had he fully recovered from that core muscle surgery that he had, and was his back really, truly protected once he got back into the swing of full contact football?
When your medical staff is evaluating a player, and I know that they get team doctors, but I would not think that these team doctors are so-called football specialists. Is that taken into account that this is a guy that's going to be running into 325-pound men on a weekly basis, 60 plays a game or 45 plays a game?
These guys are very familiar with treating injuries related to the game of football and trying to get guys back into football condition so that they can play at the top levels of the game. So they're taking all of that into account, realizing the type of player that J.J. Watt is, that he is frequently double, triple teamed on plays, and that he's going to be hit from all sides and needs to have the strength and core stability in order to protect himself when taking on these offensive linemen and running backs who are hitting them down to down.
Doc, is it fair to even try to predict how he's going to return from this by looking at other players who had similar injuries, or do you have to take it all case by case?
It is all case by case. When you look at an injury like Adrian Peterson, who blew out his knee several years ago, and the rapid comeback he had in the 2,000-yard season he had following the knee injury, who could have ever predicted that? That's an anomaly in the game. Everybody heals differently. Everybody's injury is different. There is no exact same injury. They can sound the same. They can kind of look the same on paper, but each person is a case-to-case basis. And as we know, J.J. Watt is a machine. He is going to work harder and rehabilitate harder and prepare his body more than just about any other player in the game would, because that's just the way that he dedicates himself to playing this game. So he is going to do all the things necessary to get back as soon as possible. Right now it's looking like an 8-week IR stint. And then we'll see. Is this a season-ending thing, or are we going to see him mid-season?
He gets a lot of credit, as he should, for being that workout warrior. And you just talked about how he's going to train harder, work out harder than anybody or most anybody else in this situation. Can that have a negative effect? Is there a situation where you have to emphasize rest when you try to come back from this injury?
Well, there is the component of work harder and work smarter. And yes, like you said, rest is such a key component, making sure that you allow the tissues to recover and to heal from the workouts that you're putting them through. And I think that JJ is going to be smart, realizing that, look, this is the second back injury in just a number of months, and he's got to get his body back into the condition to play at the level that he demands of himself. JJ wants to go down as the best defensive player to have ever played in the National Football League, and he's not going to settle for less than 100%.
We're talking to Dr. John Michels. He's a former first-round draft choice out of USC to the Packers, a Super Bowl champion. He also is a doctor who works at the Interventional Spine and Pain Institute in Dallas and is double-board certified in diagnostic radiology and pain medicine. Doc, when you talk about JJ and you talk about the IR and putting him into 8 weeks, that would bring him back for about the 11th week of the season. He's only 27 years old. My worry is, again, and I know I'm not a doctor and I know you haven't seen his medical files, and so I'm just asking to speculate. Should he just take the year off and rest and get strong for his? Because to me, he's coming into his prime years right now.
He is, and I think a lot of it depends on where the Houston Texans are come Week 11. If they are making a playoff push, and JJ's presence will make a huge difference into whether or not they're able to make it to the playoffs and possibly make a bid for that Super Bowl in Houston, that's going to weigh heavily on his mind. Do I come back a little sooner than maybe I am ready to because I can help this team win? If the team is struggling, it looks like they're out of the playoff race, then perhaps that decision becomes a little bit easier for him to rest his body and prepare for next season.
When you look at these injuries and you talk to some of these football players, obviously you played and you went through some injuries and now you know the science behind it all. Did that give you a different vantage point compared to the other doctors who didn't play, but obviously they're knowledgeable on the body, knowledgeable on these injuries? But knowing that you actually played and what you have to go through to get back on the field, does that give you a different point that other doctors don't see?
It gives me a decided advantage. I've been the patient. I've been the guy rehabilitating from the injury, trying to get back and play at that game. And we are all tough as nails. We all want to get back and play yesterday if we can. And I played with a guy, Brett Favre, who knew that injury could potentially cause someone else to take your job. In fact, Brett Favre's 300-game starting streak happened because Don Mikowski got injured at quarterback, and Brett got his opportunity. So that creeps in the back of the mind of everybody who plays that game. And so as a player and having been the patient trying to get back on the field, I definitely take a different perspective of the understanding of what it's going to take to get J.J. Watt back to perform.
John, could you explain for our listeners, when they say that he re-injured his back against the Patriots, that could be just a bulging disc instead of a herniated disc. Could you explain the difference for our fans, so that they might know what the difference between a bulging disc and a herniated disc?
The best way I can describe a disc in our back is it's kind of like a jelly donut. There's a fibrous outer portion, and there's a gelatinous inner portion to our discs. Now, a disc bulge is where that fibrous outer portion gets a little weak spot, and it pushes out. It just bulges outward a little bit, and it can push on the nerve roots that go down our legs and can cause pain and flare-ups and weakness of those muscles and nerves that go down the legs. A herniated disc is when that fibrous outer portion actually ruptures and that gelatinous inner portion starts to squirt out a little bit. And now you're taking up even more space around those nerve roots, and that can cause significant weakness and nerve damage. So the difference between a disc bulge and a herniation is pretty significant.
So the best case scenario here is he doesn't need surgery. He just takes some kind of epidural steroid shot to try to reduce that swelling of that disc.
That's very commonly how we treat this. Is when I see a patient, I see this every single day, who comes in with a disc bulge. Again, they have inflammation around those nerve roots. We do an epidural steroid injection, sometimes a series of epidural steroid injections to calm that inflammation down and to alleviate those symptoms, and then allow them to do rehabilitation of those core muscles like we spoke about before to get strong enough to go back and perform their daily duties. So best case scenario, he's able to do some conservative treatment like a couple epidural steroid injections to start to work on that core strength and stabilizing muscles to protect his spine and get back in 8 weeks. Worst case scenario, he's going to have surgery again.
That is the voice of former NFL player, current doctor. You don't hear that too often. Joining us on 790 IBEW Hotline. Dr. Michels, it was great catching up with you. Congrats on all your success, and thanks for your knowledge this morning.
Thank you guys for having me on today. It was an absolute pleasure.
Appreciate it, John.
Have a great day.